Well, today we have a very special guest, Carol Petersen, an accomplished compounding pharmacist with decades of experience helping patients improve their quality of life through bioidentical hormone replacement therapy. Carol graduated from the University of Wisconsin School of Pharmacy and is also a certified nutritional practitioner. Her passion to optimize health and commitment to compounding is evident in her involvement with various organizations like the International College of Integrated Medicine, the American College of Apothecaries, American Pharmacists Association, and the Alliance for Pharmacy Compounding. She was the founder and first chair for the Compounding Special Interest Group with the American Pharmacists Association. And she's a chair for Integrative Medicine Consortium, and she's a co-host of a radio show that I've been on many times, Take Charge of Your Health on WBAI, which is in New York, and on the medical advisory board for the Center of Menstrual Cycle and Ovulation Research. And of course, she's a lecturer. I met her at the ARM conference, which is a conference of restorative medicine folks. And I'm so happy that we have a nice collegial friendship and we've been on each other's shows, and it's so nice to have her. And especially, Carol, I'm thrilled to have you on for Valentine's Day coming up.
Oh, oh, how sweet. How sweet it is.
Yeah.
Thank you,
Well,
Dr. Z.
February is the month of love, and hormones have been associated with love, of course. But hormones go a lot deeper than love. They are very integral for many, many parts of our existence. So let's dive right into it and let's give a little bit of a physiology class for the lay people. We'll keep it, kind of a little bit more simple than for us professionals, but still, let's talk about some of these hormones that we make: estrogen, progesterone, testosterone, then the adrenal hormones, thyroid. So we'll just go slow one at a time and talk about them.
Okay, and you left out what I'm beginning to consider maybe the most pivotal. And actually, many years ago, I did a priority of hormone list. You left out insulin and glucose just now.
Oh, right. Okay. Well, they're not, well, I think that they're different. Aren't they different? Like there's steroidal hormones and there's other types
And
of
there's
hormones. Maybe
there's
you can
other
differentiate that for us. Yeah.
Yeah, so there are non-steroidal hormones, and by steroidal hormones are those that are made from cholesterol. And from cholesterol, we get pregnenolone, we get cortisol and all its derivatives, we get estrogens, we get testosterone, we get progesterone, we get bile, we get vitamin D. So there's a lot of ground to cover there
Mm.
with cholesterol being the kingpin. Now, I saw you tagged an article I did about low cholesterol, and I've seen,
Yeah. Yeah. Cholesterol has been a
well,
dirty word for the last 25 years, but I always
I'm
say, how could something that's in every one of our cells be bad for us? So maybe you can expound on that.
it's absolutely necessary that we have cholesterol, and I have a mission to stamp out statins.
I like it. Yeah, there you go.
I actually had a business partner who she was killed by statins. No doubt about it. She was a person who was hypothyroid, which can cause your cholesterol to be higher. She was not treated ever adequately for the thyroid. And how do I know that? Because she continued to have weight problems all her life. She had very thin, sparse hair,
Mm.
and she was very pale. So these are red flags for low thyroid. This is in spite of being on levothyroxine T4. She was inadequately treated, and so her cholesterol's high, and so she went on statins. And she was a pharmacist. She was very committed to this. And this is in spite of her coming from a very long-lived family.
Mm.
Her relatives were long lived, and guess what? Had cholesterol levels above 300. Nobody else treated it, but she did. She died at 68 with extensive nervous system damage. And on autopsy, they finally decided she had ALS.
Oh,
And about a
oh,
year from the time she died, I an article popped into my inbox about the connection with statins and ALS, definitely provoking ALS.
wow.
So, which is what I was saying all the time, but she chose not to do anything about it. And it's very sad because statins are destroying people's health. And that's an important thing. But yet I am seeing some very low cholesterol levels, total cholesterol 82. How is this compatible with life? And then maybe from 120, 132, these extremely low cholesterol levels. And guess what? You go and get that tested, and that's not even red flagged as a problem. They tell you that's normal. I know one person had a test range that said under 200. Everything under 200 is okay. Does that mean zero's okay? No, it doesn't. So,
Yeah, right, right.
this is a piece I just learned not too long ago. And I think it's very important because I've been doing some digging. Like, how do I help those low cholesterol people? So, is it a liver problem? Your liver makes 90% of your cholesterol.
Hmm.
Can we be having some liver dysfunction? Maybe. Or can you feed cholesterol and get it to go up? And there are people who've created supplements with cholesterol in it, or you can eat animal fats and protein and lots of eggs. But these feeding cholesterol doesn't necessarily raise your cholesterol levels. I've seen studies where young men were given 24 eggs a day. Their total cholesterol didn't budge. Zero.
Wow, that's interesting. Mhm.
Zero, zero. So then I'm at a medical meeting. Kind of one of the things COVID has done for us, we've got all these little enclaves of physicians bringing in speakers, and we get to chit chat and lovely to get some pearls. And out of the blue, Dr. Michael Gerber said at one of these meetings, he said, "Oh, we here all know we don't worry about high cholesterol ever.
Hmm.
But low cholesterol is a problem, so I'm all ears, right?" I go,
Yeah,
yeah,
that's totally flies in the face of this whole paradigm that is out there. People are believe that,
high
cholesterol's
cholesterol's bad.
bad. It's amazing.
Okay, so
Hmm.
the rest of the story, what he said then was, I believe when you have low cholesterol, it's a sign of parasites. Those parasites
Hmm.
are eating your cholesterol to thrive. And I go, wow. So it's really difficult to identify parasites for testing. You might find some in some tests that test your stool, but parasites, a lot of them are intracellular. You have no chance of finding them on a test. But for anybody with very, very low cholesterol, I would really encourage somebody to take on a parasite cleanse. And I see it's kind of trending in social media right now.
Hmm.
Parasite cleanses here, there. And I'm wondering, Dr. Z, if you have a parasite cleanse in your bag of tricks.
Yeah, I guess it depends on what we come up with, whether it's protozoan or other types of organisms. But yeah, sure. There's a lot of things you can do. That's for sure. Yeah. But that's interesting. So this kind of dovetails into, so if someone has low cholesterol, they're not able to make hormones, and they're going to come back on a blood test or a urine test. You can talk about testing at some point with low levels of hormones maybe, and
Yeah,
then they have to be treated. Now, a lot of times they're not treated appropriately because they may be given a hormone without looking at how the hormones are metabolized in people, which can be a real problem. It's been a problem in my office. For instance, many men come in with low testosterone, but the doctor, instead of looking for like why they have low testosterone, they just said, okay, well, we'll just give you more testosterone. And sure enough, it backfired and their estrogen went up and other things went up, but their testosterone stayed low. So it was a disaster for the
And they
gentleman.
don't even feel good. You
And they
you
don't feel, oh, they got worse. They got worse. So yeah. So tell us a little bit more about these hormones and
Okay, so
function.
I brought up this situation because I want people to be acutely aware. If you're driving down your cholesterol levels, you are sacrificing your ability to make hormones. And the statins have they don't have a good track record. The only positive study was the Jupiter study in men who they found that 1 out of 200 men being treated did not have a second cardiac episode. This is the only positive statin test ever published.
Hmm.
And so for one avoiding a second heart attack or stroke or something, 199 men had to suffer the cost of the statin drugs and all the side effects, which, as you might expect, can be incredible. And none of this applies to women. But I am finding people getting pushed into having statin drugs. What's an ideal cholesterol level? 220 to 280. If
Okay.
long life, longevity, and good quality of life is your goal, you need that kind of cholesterol level.
So
So
that's the total. That's the total
that's the total. That's
cholesterol.
the total.
Okay.
Okay,
Oh,
so you Dr. Z, do you want to recap that one example you wrote up for me to take a look at the
yeah,
person
well,
that
that kind of ties together a lot of different hormonal problems. So
yes, I
let's
think it
do
would be
that.
good if you say what you wrote down because I can't tell you how common this is. It's
Sure.
very,
So it says, so there's one, it says, despite decades of use of compounded and sometimes FDA approved biomedical hormone formulations, the conventional medical system has yet not embraced the safety and usefulness of topping up hormones as they decline. And I emphasize that. And some medical groups embrace this as a pillar of successful aging. And
yes,
then there was a scenario that you can talk about this person with terrible panic attacks.
yes. And what
Hmm.
happens to that person? So this is actually not uncommon in perimenopause, severe panic attacks. Some women feel like they want to suicide. This is such a strong
Yeah, it
feeling.
was you said brain fog in your case study, inability to sleep, incapacitating. They thought that they were dying and went to the emergency room many times, spent thousands of dollars and days of fear because, of course, it's important to rule out the heart as possible source of all those incidents, but then the heart gets an all clear
Yeah.
and cardiovascular system's in good shape, but you still have no idea as to why you have these terrible panic symptoms, and many get hooked on benzodiazepines or other anti-anxiolytics and a lot of side effects when the problem could be their adrenals. Now, this has been recognized in holistic medicine for many, many years. If you ask a conventional endocrinologist, they're like, "Oh no, there's no problem with endocrines, or there's no adrenal like sub levels of adrenal dysfunction. It's either Addison's disease or not." I think they're changing that. I actually ran into a paper, Carol, where the authors called it adrenopause. You ever hear of that? That's a great one.
I use that all the time. Um,
Yeah, yeah, I
when
never heard it before. And I said, that's a great term, adrenopause.
when you reach menopause, and that is you stop cycling, and so the ovarian contribution to your hormone status has depleted. And in naturally, we're supposed to turn to our backup system, all the hormone activity is also done by your adrenal glands. And when you have menopausal symptoms, when you stop ovulating and stop cycling and you hit the wall, this means your adrenals are not up to the job of doing your hormone functions. And
Mm,
why is this happening? I saw a figure like 80% of women hit the wall. They have some sort of symptoms. This is really quite a big problem. And some of them have some really extreme problems. And for some, it's been creeping up on them. For some, like one day all of a sudden they are crashed and can't get back to where they were.
mm,
It's a huge problem. So let me reframe what's happening here because it definitely is hormones. Okay, this is what happens. Remember, I said insulin glucose. This is a primary, super primary. And what happens is we're getting more and more insulin resistant. And so we're pouring out more insulin after our meals and things. And then we have a glucose crash. Your blood glucose goes bottoms out. I've heard that who have been on continuous glucose monitors, they are measuring like glucose levels of 30 or 50 when a fasting glucose should be 65 to 80. This is a huge crash. So what happens next? Your adrenals are called on to bring that blood glucose up. So immediately adrenaline and hopefully cortisol too. Both of these rise to get your blood glucose up. And that could be the end of it, but it's not because in a number of people, and I've heard figures like 40% of the population, and maybe you've heard otherwise, we can't turn off that adrenaline. We can't detoxify with methylation.
mm,
And so that adrenaline persists. And I've talked to people, they're in this constant state of buzz, if you could imagine. That might be an extreme. They cannot break down that adrenaline. And here's where they're apt to be running to the emergency room. They have heart palpitations, they have missed heartbeats. They have their heart like pounding on out of their chest, and it's really quite scary. Was
mm.
all triggered by a drop in blood glucose, which I heard figures on that. 10 out of 11 of us have some insulin resistance. And so it could be that there's no rhyme or reason. We're not hooking it up to what's happened with what did you eat last? What were you doing last? Or what other stressors? Certainly, this is a big one. But if you load it up with other emotional and environmental stressors, this is even magnified. So this is what I'm finding is that there's a good portion of men and women, they can't shut off that adrenaline very well. So what's a solution for that? So they need to methylate. And where we get methyl groups, we get it from methylated B vitamins, methylfolate, methylcobalamin. Um, we get it from betaine hydrochloride. Betaine is trimethylglycine, and it's a lovely thing to take at mealtime to help you digest your food, break down your proteins and absorb your minerals. Lovely supplement. You can use phosphatidylcholine, which to my surprise, I didn't know this. Phosphatidylcholine turns into betaine. Amazing.
Yeah.
And
Yes.
then there's
Choline. Uh-huh.
yeah, and then there's SAMe, methionine, which also gives you methyl groups. So you can be putting these in extra to help you detoxify. So there's another little piece of this. So I've been looking at
Mm,
um, creatinine. You see this on metabolic tests for kidney evaluation. Well, if this is kind of on the low side, you have a clue here that you're not making creatine. And creatine is a methyl sink, which means that your body needs methyl groups to make your creatine. And when it's doing that, it's taking away the available methyl groups for you to detoxify. So I've been adding this in for some people, 1 to 4 teaspoons of creatine. I've seen this pop up on social media now. Excellent for your muscles, your skeletal strength, excellent for your brain. People are saying creatine as an anti-aging supplement. And yes, you plug that hole, you're going to methylate better.
Yeah,
What's
you can see my black belt diplomas there. I don't know if you can make them out though. So
yeah.
I take a cocktail of things to make sure that I don't get so sore after a hard work at the dojo. And yeah, creatine is one of those things that I definitely take. So yeah, that's really and we just did a show last time I was on. We did a show on delayed onset muscle soreness and preventing excess muscle soreness, and creatine was part of that. So yeah, that's very interesting. So by providing the carbons and hydrogens, which is what a methyl group is, your liver is able to clear those hormones faster out of your system and they don't persist so that you don't get these cardiac symptoms or symptoms of anxiety. But what's the pregnenolone steal all about? Because that's kind of how it dovetails in with the sexual hormones, with this chronic stress and the adrenaline and whatnot.
Well, what happens is that when you have this persistent adrenaline, and at first cortisol rises with it until it can't. And then your cortisol, in which I also believe is sort of a reservoir of corticosteroid activity. There's a whole handful of metabolites of cortisol that we sometimes measure in urine testing. It can't, that's the usual place to have a look at it. So you get an idea of, does somebody have any reserve? Are they able to meet the demands of their life? When there's low cortisol, you start feeling a lot of fatigue. You're
Mm.
very prone to infections. You're very non-resilient to your environment. Everything sensitizes you. You have no cushion there. Now, this is pretty interesting because for years I've been saying progesterone really is a key thing to replenish because it can also help the cortisol out. And in the old graphs where people show like what hormone is converted to what hormone, you will see progesterone being converted to hydrocortisone or cortisol. Now they go, no, no, no. Pregnenolone, which used to just say it gets converted to progesterone or DHEA from the adrenals. Now they say pregnenolone directly makes cortisol.
Wow.
Okay, good, good. I like it. Let's have it. When you're in this constant state of stress, the reality is ultimately you're going to wipe out cortisol, all the derivatives. It's going to suck up progesterone. It's going to suck up pregnenolone. That part of the steroid cascade just gets wiped out, and that's what needs to be fixed. We talk about adrenal fatigue, and some people do not like this title because in
Hmm.
reality, the adrenals are still putting out adrenaline, noradrenaline ceaselessly, but they are definitely fatiguing all the other hormones because of that high adrenaline. So the adrenals themselves are not totally shut down. They are doing that adrenaline thing. So, one of the interesting things, so go get this cardiac workup. This is what I think, they're, as you mentioned, so they'll give you a benzodiazepine, Valium, Ativan kind of drug to try to calm you. But you know what might work better when you're in that emergency situation? I don't even like recommending drugs, but over those benzos, I'd recommend propranolol as a beta blocker. What's it beta blocking? It's beta blocking adrenaline, which is
Yeah. Yeah.
very, very
Definitely.
interesting. Yeah, three whole classes of blood pressure medications are all designed to block adrenaline. Get
Anything
rid
that
of.
ends in an all, like
Yeah.
metropol, all
Yeah.
those things are beta blockers. And then there's, of course, holistic beta blockers too, which we use. I use Danshen, which is the Chinese sage, which is amazing cardiac plant. And the Chinese always said it not only helps the heart, but it balances your shen or your spirit, which was when your spirit is disturbed, according to Chinese medicine, you're anxious, like anxious, really uptight and panicking. So yeah, so there's some good alternatives to that. Passion flower is another one that I find is very good for people in a panic like that, and even skullcap. So there's some herbal alternatives for those things too. But yeah, it's interesting that's an interesting use of those pharmacy medications there.
I love that, Dr. Z, because I've been looking particularly for what brings down that adrenaline. So,
Mm.
so one of the interesting things is that adrenaline can be metabolized to adrenochrome. This is Dr. Abe Hoffer's work. And this abnormal pathway for adrenaline was he identified it as causing schizophrenia when you hear voices and whatnot, when adrenochrome gets formed. And to block that pathway, he recommended high doses of niacin and vitamin C. So I phoned up a colleague of mine who did Dr. Hoffer's therapies, and I said, I'm working with men and women. They have this high adrenaline, but it's not the adrenochrome stuff. They're not in the schizophrenia category. Would vitamin C and niacin also help this high adrenaline? You know what he said? No, no. So he said his best recommendation for high adrenaline is exercise.
Oh, yeah, that makes sense. Do a couple wind sprints.
Right, right. And so I had a client, a gentleman,
Mm.
and I was talking with him because he's was obviously having the same issue. And I brought up exercise, and then he goes, "You just took me back to my childhood." He said, "My dad made me run all the time." He said, "As a kid, I thought my dad wanted to have an athlete as his son, and that's why he was doing it." But he said, "Just as we're talking, I realized if he wasn't making me run to calm me down, I was just bouncing off the walls as a kid, high adrenaline." So he had a history of high adrenaline. Where does this show up in younger people? It's ADD, ADHD, OCD,
Mm.
all of these things we should be evaluating those younger people for hormone disarray because it's showing up. A colicky baby already has hormone issues, too much adrenaline, maybe not enough progesterone. We need to be looking at that. So
Is there
then,
an enzyme, Carol? Is there an enzyme that breaks down? Oh, I have to do a quick ID. You're listening to WKN Bridgeport 89.5 FM. Listener sponsored free speech alternative radio and streaming live on WPKN.org. This is the Natural House Call with Dr. Z, and my guest is Carol Petersen, who's talking about all things hormones. And we're talking about the adrenals, having a deep dive into the adrenals, and we'll progress later on into other hormones. But isn't there an enzyme, Carol, that breaks adrenaline down into kind of like the byproducts, COMT or some of those other ones? I forget
um,
that there's a couple of
MA, MAO,
MAO, yeah, yeah,
breaks down adrenaline, and so does methylation.
and methylation. So that's why
The
the
two main pathways. And guess what? Back to estrogens, high estrogens.
Yeah,
Sometimes
good.
they need methylation. So some tests like urine tests identify 4-hydroxyestrone as a potentially DNA damaging type of estrogen. So this is hypothesis. This is not the be all and end all, but with that metabolite, you have exceptionally high estrogen activity. So what's the problem there? 4-hydroxyestrone has not getting metabolized to 4-methylestrone, the
Right.
less intense. So you can consider this a very good marker for not enough methylation happening. Where else can you see this on a test? If you have a metabolic test and you looked at homocysteine levels that are higher than 7 or 8, you're not breaking down that molecule, which needs methylation. And homocysteines at the point of where this can be creating plaquing for you in your arteries, because
Hmm.
homocysteine is a very, very irritating molecule, and it starts damaging the epithelium in your blood vessels. And what does your body do then? It tries to make a scab. What plaque actually is unresolved scabbing. And you can even see in plaque, according to Malcolm Kendrick, he said you can see like rings on a tree, scab, 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 scab. There's actually very little cholesterol in that plaque. So, and statins don't relieve the plaque. What are we using statins for?
Yeah, well,
Just
they are. It's interesting. I've actually seen that statins are pretty powerful antioxidants. Like I've noticed that the ox LDL, which is like oxidized LDL, which is the really bad LDL. LDL is they call it the bad cholesterol. It's not bad. It's actually responding to a bad situation, like cracks in your arteries caused by the homocysteine, like you mentioned there. But but it's not the way that nature we evolved to as an antioxidant to lower. You
no,
don't have cracks
there's
in your
many
arteries
more.
because you have a statin deficiency. You have cracks in your arteries because you're not taking in enough polyphenols, which are
Right.
important things in your diet and antioxidants and your methylation's poor or so yeah, that's kind of the way that we keep thinking like the root cause of things.
And then interesting enough, I was at a low carb USA meeting. And when you go to medical conferences, I sort of observe who's speaking. I think they should model good health if they if they have something to say. And I saw the healthiest people I've ever seen as speakers. All but one looked great. They were very athletic, very vibrant, high energy. You could feel the energy.
Hmm.
And they were running LDLs like 800, 900.
Wow.
Yeah. So um, they would say, oh, you need to statin that down to nothing, but they were healthy. So I actually heard some physician, I didn't keep track of the name, was saying, oh, there's a subset of human beings that higher LDL is acceptable for, but the rest of us need to use statins and drive it down. This is particularly where statins work. And then what do you get with driving down LDL? You get increased suicides, you get increased accidents, you get increased cancers, increased autoimmune disease. Why are you doing that?
Hmm.
Um, just
Yeah, it's all about inflammation. So we have a couple minutes and we'll have to take a break for our first segment. And so during the second segment, we want Carol to talk a lot more about using progesterone for lots of different maladies because we're under the assumption, a lot of us too, even me in school, we kind of learned that, hormones were just involved in the sexual function and maybe a few other things, bones and things, but I mean they're involved in brain health and so many things that Carol wants to talk about. And then I also want to turn around and talk about men because it is Valentine's Day. So we want to talk about men and low testosterone and why we see this epidemic of low testosterone in such young men. Is it the environment? Is it lack of minerals? Is it chronic stress like you talked about there, being in this fight or flight all the time that's stealing all your testosterone to the fight or flight, robbing from Peter to pay Paul, as the old saying goes. So there's so many um, ideas that I have, because I do a lot of work with men that have low testosterone, very successfully raise it without even hormones. Because what are we doing? We're getting to the root cause of why that testosterone is low in the first place. And so we'll end there and we'll come back with another segment with Carol Petersen, our pharmacist here extraordinaire. So stay tuned right here to WPKN Bridgeport.